Hi everyone, welcome back to our channel. I'm Dr. Mel from City Skin Clinic, and today we're going to have a little chat about what can you do about wrinkles on the forehead. This is a very commonly asked question. I'm mainly going to focus on injectables, so non-surgical treatments for this, but I'll mention a little bit in terms of skincare as well. Before I start, if you're new to our channel, welcome. Don't forget to subscribe and hit the notification bell. If you are a returning visitor, thank you so much for your support. So, before I get started, I've changed my set out a little bit. My background's a little bit more interesting. I hope you think so anyway, just because of a few comments that we had. To be honest, between you and me, I was also really bored with the white background as well. So let me know what you think of this. Anyway, let's get started. So I'm going to talk about wrinkles on the forehead. I'm going to specifically focus on two areas. One, it's the horizontal lines that you get when you raise your brows. And the other is wrinkles in the frown area as well. Both are incredibly common. Pretty much everyone gets them eventually, but when you get them and how bad they are will depend on things like age, quality of your skin, your genetics, and also if you're an incredibly expressive person, then you're more likely to get them earlier and you'll get deeper lines or they progress more quickly. The important thing in terms of thinking about treatment, it's two things. The most important one is, are these wrinkles dynamic or static? So static wrinkles are there all the time, whether you frown or you raise your brows or not, so they're ingrained. Or if they are dynamic, they only appear when you raise your brows in the case of the horizontal lines, or you frown in the case of the frown lines. This is really important because that helps determine the treatment. The other is, what are your expectations? Is it to slow them down and prevent them from getting worse? Is it to stop them from appearing in the first place? Is it to kind of completely eliminate them, or just to soften them? And that's really important because that determines whether a treatment is suitable. First of all, the two main treatments that you can have for kind of wrinkles in the face that are non-surgical and that we offer are Botox and fillers. There are also a few other treatments like chemical peels and laser resurfacing that I'll also mention as I'm talking about this, and of course microneedling as well. So Botox is the most effective, it's the most commonly used kind of non-surgical aesthetic treatment in the forehead area, and what Botox does is it relaxes the muscles that then pull on the skin and cause these lines to appear when you frown or raise your brows. Botox is fantastic, it's highly effective, it's a safe treatment if it's performed by a medically trained person, but the two things to remember about Botox is it really is only properly effective in wrinkles that are dynamic. So if they are only there when you express yourself. If the wrinkles are already set, then the Botox isn't going to eliminate the appearance of these wrinkles. So if they're dynamic, once you have the Botox treatment, especially if you have a good dose of Botox, you won't be able to see the wrinkles if that's what you want. If the wrinkles are there all the time, then even with Botox treatment, you will still see them. But Botox will still soften the appearance of those wrinkles that are ingrained. So it's not that you can't have it if the wrinkles are already set in, it's just about what improvement you'll see. So it'll soften the appearance of these wrinkles to the point sometimes where maybe they're not so visible. The other important thing about Botox is that it'll stop them from getting worse. So it's always something that is worth having in that area, as long as there are no medical contraindications to that. The second kind of treatment that is possible in that area, but it's actually quite uncommon to have it, is dermal fillers. So you can fill wrinkles directly, so especially lines that are set in there, and we use fillers a lot for wrinkles on the lower and mid face, for example, the nose to mouth lines, the marionette lines, smoker's lines. You can also use them in wrinkles on the forehead, but this is a really technically advanced procedure because there are some incredibly important blood vessels in this area. There are really important blood vessels all over the face and body, obviously, but having filler here, there is a risk if you put the filler in one of these blood vessels or if it compresses them, there is a risk of cutting off the blood supply to that area of skin, but also potentially if there's an embolus, so if there's a bit of filler that goes into the vessel, there is a risk that it can travel up and block ultimately the circulation to the eye and cause blindness. So this is an incredibly high risk area. So like non-surgical nose reshaping, like tear trough fillers, really not just a medically trained person, but someone experienced in doing this particular treatment, so a highly advanced medical practitioner. And even then, nearly everyone who performs filler in this area will probably recommend you try Botox first, because the improvement from that may be just enough to avoid such a high risk procedure. And also it just means that if you need filler after that, there's less filler needed and it's a shorter, safer procedure. So that's why filler is not very commonly used, or it shouldn't be in this area, because of the high risk nature and because there are some other options. They are not possibly as effective as filler, but they are safer and the results may be enough to be satisfactory to you. So besides Botox and fillers, there are a few other treatments. So one of these treatments is chemical peels or laser resurfacing. Both chemical peels and laser work in a similar way. They remove the outer layers of the skin and unveil newer skin underneath. And in doing some of that resurfacing, you're sort of buffing away some of the lines and the wrinkles. And also with the new skin underneath, that creates more collagen and elastin, so it should look smoother. And this is really, really effective if you have very, very fine lines. If you have incredibly deep wrinkles, it may improve them, but it's really not going to get rid of them. So it's important to be aware of that when you're considering chemical peels or laser therapy. There is a limit to these, and often the best way to improve on these results is to combine them with another treatment. So I would personally combine resurfacing treatments like laser and peels with something that really promotes collagen induction. So microneedling is one such procedure. So in this area on the forehead, you can perform microneedling, and that kind of causes these tiny vascular micro injuries that stimulates the skin to make more collagen and elastin, which help thicken the skin, and that it's a really good way to treat lines and wrinkles. Again, it's not going to be the same as obviously a facelift. It's not going to be the same as if you use perhaps some filler in that area, but it is going to provide a really good result. With our clinic, we combine microneedling with chemical peels, and that helps resurface the area, gets you some fresh skin underneath, and then the collagen induction from the microneedling builds up the skin. And that's a really good way to do that. If you're someone who has some fine lines and wrinkles, but nothing super deep, but they are there and they are set, and you are looking to improve the quality of the skin, but you're not quite keen on an invasive procedure, you can also try the Obagi New Derm system. So New Derm really removes fine lines and wrinkles, and it also treats sun damage, which often is the cause of these. And so that's a really good way to have a resurfacing treatment at home, and you can do that at a rate that is in line with how much your skin can take it and how comfortable you are. And that's something from our clinic you can access from the comfort of your home with a targeted plan with that. That leaves me to the other treatment that often in other areas of the face we use to boost the skin, and it's Profilo. So Profilo, again, it's an injectable hyaluronic acid. It's amazing for crepey skin and loose skin in the neck and in the face. We don't tend to use it very much in the forehead area, just because even though Profilo isn't a filler, it's still thicker than Botox and it's a hyaluronic acid product. So we don't routinely use it in the forehead, and we think that you can get really good results with peels and microneedling and Botox in that area. But that's another potential if you're looking for something that stimulates the skin. So Really options, if you have dynamic lines, so ones that kind of come up when you're expressing your face, then Botox is a really easy no-brainer. Or you could also and should try using more preventative skincare actives like acid exfoliants, definitely using a retinol or even better tretinoin, and that will help. And also you could try an at-home skin system that can resurface the skin. Where it gets trickier is if you have ingrained lines and wrinkles that are there all the time in the forehead and the frown area. And in that scenario, we are going to go potentially down the route of combining treatments. Probably some Botox may be involved. Most likely resurfacing and microneedling are the other things you would do. But don't forget, that's also isn't in isolation, so you want to prevent the situation from getting worse, and that really involves looking after your skin and definitely introducing things like retinol or tretinoin into your skincare routine. Definitely looking at actives and even maybe considering the Obagi skin transformation systems to really boost your skin and get it to a point where the treatments are augmented. I hope you found this video useful. If you have any questions or comments, please leave them below. I'm going to add some links to our website that explain the treatments that I've mentioned, and also our information pages about lines and wrinkles in the forehead and the frown area. If you like this video, don't forget to give it a thumbs up, and if you haven't done so already, please don't forget to subscribe to our channel and ring the notification bell. Until next time, see you.